Welcome, Jean. Thank you very much for sharing a little bit about your surgery experience. And can you explain what operation you had?
Yes, I had a total hip replacement. It was the second one I've had, but they both went fine. And I have no pain at all now.
And why did you need to have the operation?
I had an arthritic hip. I think it's a family thing. My mother had 3 new hips. She wasn't an octopus. But I think it's genetic, so yes.
And for somebody that might not know, can you explain what it's like to have arthritis? Is there a lot of pain?
It's quite excruciating, the pain. It catches you unawares. Your leg can basically just sort of seize up. Sometimes you feel like you're dragging your leg, but the pain is horrendous. Even sitting down, you've got pain, it locks up. You can't get comfortable. In bed at night, you can't turn over. You know, it just affects every aspect of your life, really.
You came to the pre-assessment clinic.
To the pre-assessment, yes.
And can you explain what tests that you had there?
Well, you have blood tests, urine tests, blood pressure. You have an ECG, and you get measured, weighed. You know, you weigh, and then you see like the senior nurse in charge who explains everything to you and gives you forms all about the surgery.
So how did you feel just before the surgery? Were you nervous?
No, not at all. I've already had one hip and I wasn't nervous. I was just looking forward to getting rid of the pain, to be quite honest. As you know, I'm sure anybody who's got an arthritic hip will know how restricting it is and how it limits what you can do.
And can you describe the anaesthetic that you had before your operation?
Right. Yes, I had an epidural where you're awake, and everything was explained to me in day surgery. I went into day surgery, and the anaesthetist came and spoke to me and explained it all. They asked me actually what anaesthetic I really wanted, and I said to them I would leave it up to them, but as I'd already had an epidural before, I was quite willing to have it again, which I did, and which was fine.
And for somebody that's not had an epidural before, can you describe what happens and then what you felt like?
Well, they take you in, and they sort of spray your back with a very cold substance, and then I think it's the chief anaesthetist, in this case a lady called Monica, who was lovely, and there was about another 3 or 4 people in the room with her. They were all nice, they were all laughing, and they were all chatting to me, making me feel at ease. And then they spray this stuff on your back, which is supposed to freeze it, and then she looks to the right place to put the anaesthetic, and then they help you, once it starts to take effect, they help you lay down again, and then they wheel you into the operating theatre, and that's fine. And then they make you comfortable in there, and you don't feel a thing.
And how did you feel during the operation?
I didn't feel a thing because I fell asleep. That was it. I thought to myself, oh, they must have given me something. Somebody said, no. So I just remember one of the young chap on the side sort of saying, it's all over now.
And so when you were back on the ward to recover, how long did it take before you could have a drink or something to eat?
Well, almost immediately. I had sips of water, and then they came round with tea. I had tea and a piece of cake, and then there was an evening meal. You just sort of carry on as normal.
How soon was it before you were able to physically get out of bed and support yourself?
Well, they got me out of bed onto a trolley for an X-ray the same afternoon, but the next day I got out of bed for the physiotherapist, and then after that it was like a case of getting yourself wandering about on your Zimmer frame, taking yourself to the loo, that sort of thing.
How did the physiotherapists help you? How did they give you the confidence to be mobile again?
Oh, they give you the aids like the walking frame and crutches, and they just explain things. They tell you how to use the crutches, how to hold the crutches when you're going upstairs, and which leg to put forwards first, that type of thing, you know, and they're with you all the way. I had the operation on the Wednesday morning and I went home on the Friday afternoon. I probably would have gone home a couple of hours earlier, but I was just waiting for medication from the pharmacy.
And can you just tell us a little bit about how you feel your recovery has gone?
I feel fine actually. It's exactly 12 weeks today since I had the operation. I've just been basically doing normal things. First week home, I went shopping with 2 crutches. My daughters were with me, and from that time, I go shopping now every week. It's just basically a case of getting on doing odds and ends, and you know, sort of trying to build up the muscle again, and just. You know, just trying to get back into a normal swing of things. The only thing I haven't attempted at the moment is to clean windows, but...
And so you're in a lot of pain before you had the operation,
yes.
So it's made a real difference having this operation.
Well, there's no pain at all. No pain at all. From the moment I got back in the ward, there was no pain at all. I've been back to see the physio chap. He wanted to see how much... I was progressing, and I've also seen one of the surgeons who has now made another appointment for me, just to come back, just to have another X-ray, just to make sure everything's going fine, which I feel it is.
And what would you say to somebody that's not had a hip operation before and they're feeling quite anxious? What's your message to them?
I know the people in the ward with me, a lot of them had been in there longer and they hadn't got out of bed, and I think they were frightened actually to attempt to put any weight on their leg. But I think once you overcome that fear and you realise, you know, just go for it, because you just don't have any pain anymore. The pain that was there before is you feel normal.